Hello guys, welcome back to my YouTube channel Dr.Rahul Today we are going to discussing about the specialized transport of drug, and so continue to watch my video at last and never skip this video. If you are new at my YouTube channel, then please subscribe, like and share my YouTube channel, and never forget to press the bell icon so that you will get notification of all video uploaded by me on my YouTube channel. Let's start this video without escaping the time. Firstly, the specialized transport. The specialized transport is subdivided into two type of transport. First is carrier transport, and the second is vesicular transport. So, firstly, we'll discuss about the carrier transport. As you see on your screen, that all the membrane having transmembrane protein, which serves as carrier or the transporter for the physiologically important ions, nutrients, metabolites, and transmit etc across the membrane, right? And this type of transport is known as carrier transport, and the carrier transport is specific for the substance and comparatively inhibited by the analogous, that is it is inhibited by competitive inhibitor. Now we will discuss about the classification of carrier transport. Depending upon the requirement of energy, the carrier transport is further subdivided into two types. First is facilitated diffusion, and the second is active diffusion. Firstly, we will discuss about the characteristic of facilitated diffusion, and the first characteristic is that the transporter belonging to the superfamily of solute carrier, that is also known as SLC transporter, are used in this type of transport, and there is no need of energy, right? And the substance translocate from in the direction of electrochemical gradient, and that is the substance move from higher concentration to lower concentrations, right? And the example of facilitated diffusion, as you already know, that the entry of glucose into the muscle and fat cell by the glucose transporter, that is also known as GLUT4, right? Now we will discuss about the active transport. And firstly, we will discuss about the characteristic of active transport. As you already know, that it require energy, and it is also specific and inhibited by the metabolic poison, and transport the solute against electrochemical gradient. That is in this type of transport or diffusion, the substance move from lower concentration to higher concentration, which resulting in the selective accumulation of substance on one side of the membrane, and the substance and the drugs related to normal metabolite can utilize this type of transport. And example, the levodopa and the methyl dopa are the actively absorbed from gut by the aromatic amino acid transporter. In addition, the body has developed some relatively non-selective transporter like p-glycoprotein to deal with xenobiotics, right? And this statement is very important, so you should remember this. Now we will see the classification of active transport. The active transport is further subdivided into primary active transport and secondary active transport. Firstly, we will discuss about the primary active transport. In this type of active transport, the energy is obtained directly from the hydrolysis of ATP, right? And the transporter belonging to the super family of ATP binding cascade, and that is ABC, and a transporter whose intracellular loops have ATPase activity, right? And they mediated only efflux of solute from the cytoplasm either to the extracellular fluid or into the intercellular organelle, that is intercellular organelle like endoplasmic reticulum, mitochondria, etc., right? Now we will see the secondary active transport. In this type of active transport is affected by the another set of SLC transporter, and the energy to pump one solute is derived from the downhill movement of another solute, that is mostly Na plus, right? And this type of transport is further subdivided into symport, antiport and uniport. And firstly, the symport, and that is also known as contra transport, and when the concentration gradient are such that both of the solute move in the same direction is called the symport or contra transport. And anti-transport or exchange transport, when the concentration gradient are such that the both of the solute move in opposite direction, then it is termed as antiport or exchange transport. As you already know about this type of transport, because and this type of transport is already discussed in your previous classes. Now we'll discuss about the some important point for the facilitated diffusion and active transport. And first is the carrier transport. Both of facilitated diffusion and active transport is saturable and flow the Michael-Mental kinetics, right? And according to Michael-Mental kinetics, the maximum rate of transporter is dependent on the density of transporter in a particular membrane and its rate constant, that is Km, and it is also known as Michael-Mental constant, right? And another factor you should remember in your mind is that the genetic polymorphism can alter both the density and affinity of transporter proteins for the different substance and thus affect the pharmacokinetics of drugs. Now the vesicular transport, which include the endocytosis and exocytosis. The certain substance with large uh, or impermeable molecules are transported inside the cell by the process is called the endocytosis. Well, extrude from its that is from cell by the process that is known as exocytosis by enclosing their particles into tiny vesicles, right? And now we will discuss about the mechanism of vesicular transport. Firstly, the binding of protein located on the membrane complex with the substance and initiate the vesicular formations. And the vesicles then detached from the membrane and may remain stored within the cell, and or it may release the substance in the cytoplasm, or it may move the opposite direction of the membrane and fuse with it and release the substance across the cell, and that is known as exocytosis. And the previous we have discussed that it may release the substance in the cytoplasm or cytoplasm. This process is known as endocytosis. Well, it may move the opposite to the membrane and fuse with it and release the substance across the cell, and this process is known as exocytosis. This is the mechanism of the vesicular transport. I hope that this video will be knowledgeable and informative for you. Thank you for watching my video at last.